This technique video demonstrates a novel trochlear osteochondral allograft matching technique. There are 4 preoperative measurements that need to be obtained based on the patient's preoperative MRI. These will be communicated to the allograft procurement manufacturer to allow them to match a distal femoral allograft that most closely fits the measurements. This will provide a clear representation of your patient's trochlear anatomy. The measurements we collect are the proximal trochlear width, or PTW, the distal trochlear width, DTW, the proximal sulcus angle, PSA, and the distal sulcus angle, DSA. The PTW and DTW can be measured on the axial images of the MRI. The distance between the medial and lateral ridges of the trochlea is measured both at the proximal extent of the trochlea and at its distal extent of the trochlea before entering the notch. The PSA and DSA can be measured on the same MRI images that were utilized for measuring the PTW and DTW. Lines of best fit were superimposed onto the downslopes of the trochlear groove to measure the sulcus angle. To illustrate our intraoperative measurement technique, we utilized a cadaveric distal femur. The lesion gauge is positioned overlying the defect. The gauge should be positioned so that it is flush to the bone at the 12 o'clock position. The trochlear drop was then measured at the 6 o'clock position from the end of the lesion gauge to the underlying trochlea. The proximal medial and lateral uptick markings were made on the graft at the medial and lateral locations where the gauge either comes into contact with the bone or where the gauge comes closest to the bone if it is not touching. The clock face position of these markings were noted. The same technique was performed for the distal, medial, and lateral uptick markings. This provides a total of 6 points of reference for graft preparation and placement. Once the gauge was appropriately positioned and the clock face positions are recorded, a guide wire is placed through the gauge into the recipient site. This guide wire will provide a trajectory for preparation of the recipient site. The lesion reamer was then utilized to ream to an appropriate depth. Ideally, this creates a 1 to 2 millimeter wall at the 6 o'clock position. This was the appearance of the prepared recipient site. The depth gauge is then placed into the recipient site and the depth is measured at all 6 points of reference. We then turned our attention to the donor graft. The graft was placed into the MTF graft station and the lesion gauge is placed through the aiming arm. The gauge should be touching bone at the 12 o'clock position, analogous to the technique used on the recipient site. One should then orient the gauge to best match the points of reference that were measured on the recipient site. Typically, the trochlear drop is matched first, and then the medial and lateral uptick points. Through the aiming guide, the core reamer is used to cut out an allograft plug. The plug can be freed from the allograft distal femur utilizing a sagittal saw perpendicular to the coring reamer trajectory. A freer can be used to aid removal if necessary. The 6 measured depths from the recipient site are then marked on the donor allograft plug. The sagittal saw can be used to cut the plug to the appropriate depths at all reference points. The allograft plug is then gently pushed into place using your finger and final impacted with the tamp. The resultant trochlear osteochondral allograft can be seen here.